Yesterday's debate on the House floor over the Protection of Women and Girls in Sports Act illustrated the stranglehold that the trans movement has on the Democratic Party. In arguing against it, Democrats claimed that this legislation would lead to genital inspection by coaches and others. They argued that the number of cases of gender-confused males in female sports is extremely small. Now, we saw a similar argument recently with the release of a study last week claiming that fewer than 1 in 1,000 U.S. teens under the age of 18 with commercial insurance received puberty blockers or hormones from 2018 to 2022. So it's a huge problem when they're pushing for government restrictions on counseling or forcing the use of certain pronouns. But when it comes to laws protecting children from irreversible surgeries and drugs, well, it's really not a problem. There's not that many cases of gender dysphoria. So which is it? Joining me now to discuss this, Dr. Jennifer Bauwens, the director of the Center of Family Studies here at FRC. Dr. Bauwens has worked extensively as a researcher and a clinician providing trauma-focused treatment to children in foster care and behavioral health settings, and also to adults who experienced interpersonal traumas. Dr. Bauwens, thanks for joining us today. Welcome back to Washington Watch.
It's good to be with you, Tony.
Okay, let's start with this study that I read a story about it in the AP last week. Give us the overview and then unpack it for us.
Well, if you just read the AP or NPR, you'd think, oh my goodness, this giving out puberty blockers, cross-sex hormones, it's just not really that big a deal. Not that many people are affected. So if you pay attention to that spin, then, you might be inclined to ignore the problem. However, if you actually look at the study, and many studies that go along with this issue or address this issue, you see a number of real problems with the methodology. Mm-hmm. Starting with, for example, the sample. How did they get the sample?
That jumped out to me right away because in the first paragraph or second paragraph, it says that this is a study of adolescents with commercial insurance.
Right.
And not many insurance covers this yet because they've not been able to force them to cover it. So they're going elsewhere to get this type of treatment.
Right. And we know Medicaid has been providing puberty blockers.
And they excluded that from this.
Yes, they exclude it. GoFundMe, Planned Parenthood.
This has become an industry for Planned Parenthood.
It has become a huge industry. And I might just back up so that our viewers understand a little bit more about the sampling issue. So we're just coming off an election. We're all thinking about polls, et cetera. If we look at history, we have a great example of how this study fits into our historical knowledge of research. You take, for instance, the election of FDR. He was running against Alf Landon in 1936. And everyone was predicting that Alf Landon would win. Most of us don't even know who Alf Landon is.
I didn't vote in that election.
You didn't vote in that?
No, I didn't.
Okay, good. Now we know your age, Tony.
Okay, all right.
But so what we learned from that polling data is that they went for those citizens, U.S. citizens who had telephones and had automobiles. At that time, that was not as common as it is today. And they ended up with a faulty polling data because Alf Landon clearly did not win by a landslide. And in fact, Gallup, that's where he got his start, was because he predicted that FDR would win and that people who didn't have a lot of financial mobility would vote for FDR. And that holds true. So what's the lesson here? The lesson is when you don't accurately depict your sample, you can end up with a very bad impression about what's going on in reality. And that's the case with this study here. We are told that not many people are on puberty blockers or cross-sex hormones or getting transgender procedures. That's not true. We have other studies that show about 63,000 prescriptions have been written annually. About 6,000 surgeries have been conducted. And so what's the discrepancy? Again, going back to they're only looking at private insurers. And they're making these huge claims that this is such a small problem. But in reality, we know that's not true.
But look, I'm not a pollster. I took statistics in college, and I understand that, and I read polls. You can reach an outcome that you want based upon your sample and what you try to do. This clearly had a desired outcome.
Clearly. And actually, if you look at the other study that goes along with the one on puberty blockers, it specifically looked at transgender surgical procedures on minors. And what you see in that write-up it's just profound. The authors compare these transgender procedures to a condition in biological men. We shouldn't even have to say biological, but men. And that's where they have swollen breast tissue. And they're saying if somebody wants surgery to remove that breast tissue that may be due to hormone imbalances, that's a type of gender-affirming surgery. So their whole study is constructed on the notion that somebody who has a physical problem to deal with, to cosmetically look more like their biological sex, then that constitutes a transgender procedure. When those who are getting transgender procedures it's completely psychological, it has nothing to do with the physical. So that right there just shows you how much they're going to prove their point that this is not, it's not about good science. It's about their ideology and their worldview that they're wanting to research.
A desired outcome.
A desired outcome.
So let me go back, Dr. Bauwens, to what I said at the beginning, because correct me if I'm wrong, but it seems like over the last couple of years, we've been told that this is a huge problem, that we have all of these children that have gender dysphoria. You and I've talked about this on the program. A lot of it kind of a social media contagion that has spread. And that they were putting that number out there to, one, in many cases like California, block access to counseling. They're doing everything they can to lock these kids into that gender dysphoria, that confusion. But now that 26 states have actually passed laws that prohibit these experimental surgeries and drugs on minors, and it's gone to the Supreme Court, they're changing their tune, saying it's not really a problem. And so you're taking a sledgehammer at a gnat, is essentially what they're saying.
Yes.
So how can it be both things at the same time?
Yeah. Now it's no big deal, but before it's like, how can we do this to so many people? The fact of the matter is we do know that there's been a rise in those who are even getting diagnosed with gender dysphoria. So that doesn't even count for those who aren't going to clinical practice. So there is a clear rise, and there is a clear rise in the number of people
it's a problem.
receiving it. And it is a problem.
And a lot of this, in your background with trauma, a lot of this is connected to trauma.
Absolutely. It's connected. We're not dealing with the root issues. And the fact that we're even using these procedures on one child should constitute legislation.
So I just want to be very clear here. We're not saying that this is not a problem. We're saying it is a problem. Yes. And I see it, and again, you're the expert, but as I see it, you have two issues here. Number one, you have this social contagion that's out there, this promotion that this is cool, this is thing. But then underlying that, you have this rise in trauma through sexual abuse or emotional abuse. And oftentimes, again, you're the expert, correct me if I'm wrong, but oftentimes this is a form of response in terms of defense against further abuse and trauma.
Yeah, and I want to say this too, Tony, that we used to think about exposure to sexual material at an early age as a type of trauma, right? And now we've just institutionalized it, and we have kids exposed to sexual material early on across the board. It's like our own COVID pandemic in the school system.
Right. Well, and we actually schools actually want to expose them with their sexual education material that is pornographic in its content.
Right. So you're absolutely correct in saying, we do have two different issues going on. We have the rise of trauma in our society, but then we also have this social contagion, which is very much at work on this issue.
And so we're saying, yes, we need to deal with it. Surgeries and drugs are not the way to deal with it, but counseling, therapy is the way forward, and that avenue has been blocked on many occasions by these same people that are doing these studies saying that it's not a problem.
Right. Right. And again, we have a whole system at play that needs to be changed, because researchers, it's not right to call this an objective study and have other news outlets pick this up as an unbiased. I think AP News said this is the most reliable data point.
Right.
Well, we have a number of other data points that show that these numbers are not reliable. And clearly we have a worldview that has been fueling this research question. And it's been used, this whole study has been used as a political weapon.
To arrive at a desired place. What other anomalies do you see with this study?
Well, I think that one of the things that probably has been less discussed is the fact that they talk about the gender dysphoria diagnosis, how they arrived at their sample, but then they also talk about gender diverse people. And so, from a research perspective, if you're going to look into something, you need to define your terms really very clearly. And here in this study, it's kind of like they're lumping in a number of terms, and we don't really know, okay, is it a diagnosis that you're looking at, or is it, what does gender diverse mean? It's like gender fluid. Okay, who are these people? How do you measure them, and how do you predict that they're going to stay in this continuum of, whatever it is? You can't. You can't. It's not clear. So, like this study, like many of the other ones, you can easily pick them apart, and it's sad. It's really gives science a bad name.
It does. It just like we saw what happened to healthcare during COVID. It really lessens the trust, weakens the trust that Americans have in these institutions. And I want to, we just got a couple minutes left, Dr. Bauwens. I want to ask you this question, because you have come out of the academic world, in the research world. We've seen recently how corporate America has kind of backed away from some of this DEI wokeness, and I put this into that same category because it's all comes out of the same basket. Will that reach education? Will academia, will they come to their senses and begin to do valid, trustworthy research that is not constructed to reach a predetermined outcome?
I think that actually this administration has a grand opportunity before them, and to address some of the things that are less, exciting and interesting, and that is, let's go after the grant funding. Let's go after the money that taxpayer dollars are currently spent on issues like this, on the trans issue, that most Americans don't even agree with. And so I think that a number of academics will come to their senses when their pocketbooks are affected, and there is no longer money to fuel this type of research. It might surprise us how quickly their ideology shifts.
Well, it does underscore the big carrot, I guess it was almost a stick, that the federal government has with all of the funding that it provides for research, because nobody else is going to pay for this stuff.
Right. I mean, you have a few activists, but they were smart. They propped up a number of universities with huge endowments, and with kind of the stipulation that they would research this stuff. I mean, you have to give it to them in that sense, that they were smart to do what they do, because they have a continued discourse that they are funding, and that they've started, that they can kind of back out from.
Well, there's just another area that we're going to need to be watching and speaking into and praying about as we go into this new administration. Dr. Jennifer Bauwens, always great to see you. Thanks for stopping by.
Good to see you too, Tony.